YUVA 2021. This is our third YUVA program. Actually, we three. Today, the speaker of the program is Professor Priya uh, and my guru, my guide, Professor Shivkumar sir, and myself. We three are from the day one. That is UR 19, UR 20, UR 21. All these three programs we are there. So now with our group, uh, Mrs. Harini Swaminathan from US and Mr. Somasundram from Madurai. Those two are joining with us. We are very happy because they are voluntary. They are coming to help us because they want to do something for the students. So they are with us. Thank you, both of you. And both of them were completed their MBA program in SRM Sri Ramachandra Medical College. I congratulate you people for your motivation for the students, and I thank you very much. I thank you for your support to our ANT Trust. Let me explain how this ANT Trust is working and what is the objective of this today that UVA program. The ANT Trust is doing social, educational, and uh, social, educational, and medical work for all people with the objective to serve the society. ANT is working towards to eliminate medical poverty and social exclusions. ANT, Educational, Medical and Social Welfare and Development Trust, aims to address the growing medical shortage in rural area. The ANT Trust has been implementing its objectives through medical camps, educational and medical seminars, and training workshop as of July 1, 2016. Recently, we completed our 5 years. After May 23rd, all the events are held in the commemorate of demise of the first and former treasurer of ANT Trust, late Mrs. Kasturi Trivengada Ramanujam, who is my mother. ANT Trust is functioning under the chairmanship of mine. That is, I'm having 21 years experience in hospital management. Mrs. Pondicherry is the secretary. Trivengada Ramanujam is the treasurer. Mr. Mohammad Ibrahim is the advisor of the ANT Trust. The following who are working in the medical and educational sector: Mrs. Ratikala Tirunavukarasu Teni, Mrs. Priya Sarvanakumar, who is the speaker of today's program. She is also one of our management trustee, and Mr. Shantosh Kumar from Thiruvananthapuram. These people are our trustees from medical and educational programs, and Mr. Durai Thiruvengadam and Jabba Singh from Nagarkovil, who are engaged themselves in the social work. Mrs. Vanita Manibalan from Rasipuram, Kala Vedamurthy from Vedaranyam, India, who are working in the medical sector and other functioning members. From the first day itself, my kids in the sense I'm including my students who have studied at Madurai Kamaraj University, everywhere. My students, along with them, my kids, my son and my daughter, Agilan and Niveda, have been trekked for ANT Medical and Trust, Social Welfare Trust to reach its peak. They are working, they are giving their at least minimal support, but from the first day itself, they are working with us. The medical activities, what we are doing is in the medical camps at 16 villages so far, over 2,000 beneficiaries. ANT Trust has provided the diagnosis tests like ECG, echo, bone mass density, X-ray, cardiac blood pressure, and blood laboratory test at free of charge. Blood samples were examined and their blood type was identified for the government school students, including Patamuttur and Malapatti. ANT Trust conducted a seminar at three government rural primary sectors of Tamil Nadu, India for food habits and identify the body mass index and provided nutritious meals. And one more important program is YSS without anemia. According to National Family Health Survey 2015-16, 54.8% of the women aged 15 to 49 and 50.4% of children under the age of 5 reported anemia in Tamil Nadu. Among non-pregnant women aged 15 to 19 in the state, 53.9% of the urban and 56.9% of the rural population are anemic. With this problem statement, our trust is planning to conduct an awareness program called YSS with anemia, that is Soga Illa Solai in Tamil, to combat the anemia related to combat anemia. Anemia related competitions in the schools, distribution of food pairs to avoid worm infection, and distribution of iron supplements are the content of the program. Keelatottam in Tanjavur district, Pulangulam in Madurai district, and Malaipatti in Virudhunagar districts are the selected villages to conduct this awareness program. Actually, myself and Priya Sarvanakumar madam, we both did an research in this oasis without anemia, and we submitted a paper that was accepted, but because of the COVID, the program was postponed. That educational activities for A&T Trust organized motivational speech on impossible says I am possible, social cohesiveness and personal branding for 5 colleges in Kanyakumari district to uh, Namakkal district. Then we conducted seminars, workshop on the topics like healthcare administration, hospital administration in 10 institutions that includes Madurai Kamaraj University, Vivekananda Girls College, Tiruchengodu, Mangayakarsi College, Madurai, uh, national level seminars, YUVA and Sagia. We conducted Sagia at Trivandrum. YUVA, first YUVA we conducted at Madurai, second YUVA we conducted at Tanjavur. A&T Trust is continuously conducting seminar and educational opportunities in the healthcare sector for government higher secondary schools. So far, A&T conducted such seminars of the schools in Virudhunagar, Ramanathapuram, Pudukkottai, Tanjavur districts of Tamil Nadu, and we provided NEET, that is pre-medical preparatory books worth of 1 lakh distributed to government elite school Ramanathapuram in the program I to the medical college for medical aspirants. The thing is, 6 of the students of this school were selected for uh, MBBS. They got seat at MBBS college in government colleges as well as the government seat in the private colleges. And social activities, so 2 phases of medical packs of rupees 25,000 were given to the flood relief at a medical collection center Thiruvananthapuram. Uh, and we did lot of activities during the Kaja storm in the Pudukkottai districts. 3 phases of worth of 3.5 lakh rupees we materials we supplied for the people, and we conducted summer classes at free of cost in the rural areas. 10 days art and craft workshop, all those things we conducted. Come to our YUVA, this is about our activities, what we are doing, and we are running on track. Every day we are doing some activities. And YUVA 2019, that is the Innovational Hospital Administration. YUVA 2020, that is the theme of that YUVA 2020 is quality healthcare. The theme of UR 2019 is Innovational Hospital Administration. 2020 is Quality Healthcare. You are all know that UR 2021, that is the impact of COVID-19 on healthcare management. In our UR 2021, so far, the registered institutions are kindly mute, please. Uh, the institutions so far. Yeah. Kindly mute, please. Yeah. So far, registered with us as are the following institutions were registered: University of Hyderabad, Madurai Kamaraj University, Westport University of Paramedical Sciences, Thrissur, Bonchakas College for Women, Tanjavur, TIPS Global Institute, Coimbatore, Srimati Indira Gandhi College, Trichy, Dr. SMCSI Medical College, Karakonam, Thiruvananthapuram, Srimati Indira Gandhi College, Rio Hospital for Maternity and Children uh, were registered for this UR 2020. I hope all of you are there in the meeting in this UR colloquium. And why? What is the need of this program? What is the colloquium's objective? Actually, I have explained why we intended to conduct this UR 2021 on this impact of COVID-19, because the daily infections and deaths are declining as a result of several weeks of lockdown during the second wave of corona infection. But we must be very careful when lockdown controls are eased, because experts predict a bad third wave in future. It has been warned that it will be the harsher than the previous two waves. In the meantime, we must now be prepared to deal with the impact of the declining second wave and predicted the third wave. So what we have to do, we need practical change. The mobility and the economy of the people in the present context depends on the health structure of the country and the manpower of the health sector. Hospitals in the area should implement a circuit breaker curfew in the event of an outbreak of the coronavirus in the area where patients have difficulty coping. The virus is spreading by aerosol and direct contact. There are no direct procedures for measuring aerosol concentration, but carbon dioxide is said to be the substitute for the aerosol. And increase in the concentration of carbon dioxide may increase the concentration of the aerosol containing the virus. Density levels of the carbon dioxide should be prominently displayed in the offices, shopping malls, buses, trains, train stations, schools, colleges, and other public places. Cross ventilation should be improved, and immediate crowd control measures should be taken if the concentration of carbon dioxide is more than 100 particles per million. The air temperature control system, including heaters and refrigerators, must be configured. Air changes 12 times per hour. Also, in the system, a high capacity particle air filters and air purifier should be used. Indoor meeting with large crowds must be cancelled. The opening of windows in luxury buses and trains should be encouraged to improve cross ventilation. Special time should be allocated for senior citizens and pregnant women in banks, supermarkets, for and other maybe other markets are in the market also, vegetable markets. Special attention should be paid to the patients with black fungus. Recently cured corona patients, especially diabetes, should be monitored regularly. Seek admission, seek attention immediately if you notice any symptom. A specialized hospital with nutritious and medical professionals should be set up to improve the health of those suffering for the long-term corona disease. The vaccination should be carried out as a people movement. As a movement, it should be carried out. Vaccination process should be simplified for those who do not have a mobile phone and live in technologically backward area. Transportation should be arranged to the vaccinate Transportation should be arranged for the vaccinate the disabled, immune deficiency, and elderly patients. In case of any problem in transportation, we should go to the home and we have to vaccinate them in their home. Then, what are the structural development we need? Research should be initiated to establish oxygen products plants at low investment to ensure that hospitals in urban areas are sufficient in oxygen supply to avoid the disruptions in the oxygen supply in rural areas. Explore the cheap pressure swing adoption system, Joe-like technology, sodium chloride, and the iron powder technology. Currently, these are all the technology they are using in submarines for this oxygen things. In those areas, the research should be conducted. This pressure swing adoption system already in Thrissur Medical College and other colleges, they are implementing these systems. So using these systems, we have to implement some oxygen plants. Research should be initiated to create low-cost negative pressure chambers and isolation chambers in hospitals with lower air pressure than outside air pressure. Such rooms should be used to treat tuberculosis and other infectious after the virus has been eradicated. This corona will be eradicated. After that, we can use the room for the tuberculosis or other infected patients. Hospitals should be inspected for ventilation and measures should be taken to prevent the spread of aerosol of the pathogens. What about the children health? The third wave is predicted to affect children and patients with low immunity. So we need to act quickly to protect them. It is important to pay close attention to children with asthma or childhood diabetes or other immune disorders. Data on such children should be examined and compiled by the medical team of the primary secondary health centers. Test protocols for the such children should be developed. Health identification cards should be issued to identify them and priority should be given to the medical treatment and vaccination. There may be a severe shortage of structural facilities and staff in a pediatric ward. The treatment protocols of this division should be laid down and extensive training to be given to the physician accordingly. Hospital waste disposal protocol should be examined in detail. to prevent health problems and environmental hazards. Bacterial and fungal infections can develop if waste discharged from the hospitals and homes of patients with coronavirus infection is not disposed of properly. It would be huge collection of environment uh, if plastic was not removed from the personal protective equipment. Plastic is mixed with the personal protective equipment, so it's a huge collection of that waste. Uh, so we have to isolate them. Garbage generated by isolated patients at the homes poses to risk to cleaning staff as they need clear protocol for handling such garbage. So we have to segregate the wastage and we have to do the the genetic sequence helps researchers. What about the research is essential. The genetic sequence helps researcher and policymakers to understand the mutation of virus and its variant. In India, only 0.1% is reported to be deployed. We need genetic forensic analysis to understand epidemiology and viral types. This will help in immunization planning and control strategies. The first long-term study Framingham Heart Survey should be conducted in different geography like that. Like Framingham Heart Survey, we have to conduct in different geographical areas of India and among people of different ages to learn about the nature of the corona disease. I hope these are the vital points we have to discuss in our colloquium. Hope the speakers will concentrate on these areas because from pharmacy benefit management to uh, waste management, the speakers are going to